All right, you're good to go, Candy.
Okay, thank you. Good morning, everybody. Um, my name is Candy Cooley. I am the Peer Recovery Support Specialist for the ACE program. We are part of the Drug Free Moms and Babies through the Perinatal Partnership, and our site is with the WVU Medicine in Morgantown. So I'm going to talk about stigmatizing language and some of the things that we can do to make some changes and be more aware of not just ourselves, but other people. Um, Also, let you know I'm a person in long term recovery. Um, I'm also a mom too, so have a little bit of experience with this. I've been in recovery. August 10th will be 15 years. Um, and my little tiny baby is 34. So I've been a mom for a while. Um, and I've been doing this job. September will be 9 years since I've been doing this job. So this job's kind of given me a different perspective of stigma and things that people who are pregnant and parenting go through with substance use. So some of the things we're going to look at is just like the social stigma, the stigma that's like all around that everybody, anybody who's dealing with addiction is, um, you know, sees right in front of their face in their home or, out in the community. Stigma in the healthcare system. Also the internal judgment that a lot of our folks go through and, how we can be aware. And then I'm going to talk a little bit about the drug-free moms and babies and the ACE program, just because that is a big thing that we can do to help people. So, some of the barriers that prevent people from seeking treatment, of course, feelings of guilt and shame. A lot of people are told that if they go through withdrawal, that they will harm or kill their baby. A lot of our folks have history of trauma, sexual trauma, physical trauma, um, and that's a huge barrier for our people. It's hard to trust whenever you're carrying all that. And of course, domestic violence and coercion, we see that quite a bit. Mental health, lack of transportation is huge in our state, as everybody knows. A fear of the legal system and CPS and having their children removed, lack of maternity care in our state. Um, in the middle of West Virginia, it's very, very difficult to have any type of maternity care. And of course, fear of judgment and stigma from healthcare system, family, friends, the recovery community, pretty much everybody. So the social stigma um, that is all around, what is, basically like in people's face all the time. Like I said, it's what you see in the newspaper, it's what you see on television. If you want to go ahead and advance so these are things that are actually were put on Facebook. Um, Saying that people should be sterilized, um, that um, anybody, people should just automatically be jailed. Um, you know, just on and on. I have a couple slides of this. It's just, you know, very, very disheartening. And especially if you're someone who is pregnant and you want to get help, want to get OB care, want to get treatment or, anything. It's really, really hard when you're reading these kind of things. You want to go to the next one? Thank you. Yeah, again, saying that people should be sterilized. that people should go to jail. People should be forced to go through withdrawal. Um, I think it may be the next one. I did have one that there was somebody who she put a comment saying that, she was scared and she really hoped that, um, she was on medication. She was really hoped that, she didn't have to go through these things and, that her baby would be okay. And people were commenting on her comment, saying that, well, she shouldn't have been doing drugs in the first place. And,
I think it was on the first slide. Sorry, I was like reading through through them. This one
okay,
here.
I'm sorry. It's hard for me to see because I'm on the phone and it's so small. It's
Oh no,
that.
you're fine.
Yeah, that's that one in the middle. I mean, that's just, if you think you're pregnant and you're scared, you're genuinely scared for your baby, and then, you're kind of sharing your fear and being vulnerable and saying that you're fearful, and then this is the kind of stuff that people are replying to you. Um, that's doesn't make people want to come and get treatment. People saying that, babies were better off, had passed away, that they were better off than being raised by a mother who was a drug addict. Um, these are things that I can tell you. I live in a really, really tiny little town, and I was at the post office. Our town has nothing but a post office, but I was at the post office and I heard some people talking about, I guess, someone in the community or something, and the remarks that were made were just horrendous. Of course, I had to speak up and let them know that, there are people out here trying to help those who are dealing with substance use. Okay, stigma in healthcare, which is honestly something that I did not know until I started this job. Um, this slide right here is actually condensed down because the original slide that we have, my supervisor had been collecting things that we hear in the healthcare system, um, from case managers, from people at the reception desk, doctors, nurses, just everybody, So this is things that we hear them say. And I mean, crackhead, they don't deserve to live, um, drug babies. I hear drug babies a lot, or crack babies or meth babies. I hear that quite a bit. Um, Baby deserves a real mom. Um, you know, and just imagine these are things that are coming from our healthcare system. So this was somebody I went to a first OB visit, and this person was pregnant for the very first time, and they were 26 weeks, and they were in a Subutex program, so they were actively working on the recovery. Um, she did not know that she was pregnant until she started feeling some movement. So at 22 weeks, she called to try to get an appointment, but she has no driver's license, no car, and she lives in Salem. So she's not close by a hospital that she can get OB care. So she gets to the quickest appointment that she can get scheduled and she can get a ride to. So whenever we go in, the person at the receptionist is like, getting her signed in and asking her information, and says, "Oh, this is your first appointment with us." I don't think that person meant it in any way. I'm sure that person didn't, know how far along she was or didn't know anything. But that statement, like, I could kind of feel her, you know, it you could just feel how she took it. So we wait in the waiting room, and then we go back and we get roomed. And the nurse comes in and says, "Hey, you can fill out this form, then we can get your records from the other doctor's office." And um, you know, she says, "You were seen somewhere," like, and again, you know, that little comment kind of made her, you could just see her like shutting down. And then, when the doctor came in and said, "Well, since you came in so late in pregnancy, because we haven't seen you yet, since it took you so long to come in," those kind of remarks, you could feel her shutting down and shutting down. So, when you are dealing with that, you don't want to come back to another OB visit, you know. And in our state, we have a lot of people who don't have OB care or have one OB visit, and then they come in to the emergency department because they're in full labor. So, if this is a really good example of the double standards, and like looking at substance use. Having someone who is admitted with gestational diabetes and their baby is growth restricted, so they have to be, have to have a diabetic diet, and the staff is like following their glucose measures and making sure that the insulin is being changed for whatever requirements they need. And that family comes in and they can bring in McDonald's and a milkshake and whatever, and nobody nobody says anything to them. And then later on, this person is super lethargic. um, if you've ever felt high blood sugar, everybody knows what low blood sugar feels like, but high blood sugar is basically like, you're just tired, you don't want to move. And so, if the nurse comes in and sees this person like this, they don't question. They don't have the room searched. They don't get reprimanded. They don't get judged or, a referral put in. They don't get security called. Their visitors aren't restricted now. So is, if someone is dealing with substance use, then that is handled very differently. Those people are automatically drug screened, their room can be searched, notes get written, and whenever healthcare professionals write notes, a lot of times, um, CPS can see those notes. So, putting something that you assume can be, taken uh, in a different way whenever a case manager or CPS or someone is looking at that, because they're looking at that as that's what was seen. And of course, like security getting notified and visitors being restricted. So this same person, admitted to labor and delivery, they asked to go outside. They get they get to go outside. They have an IV, and the IV is just, they're unhooked, but they're not, the IV is not removed or anything. They can go to the cafeteria, eat whatever they want, go outside with the family and do whatever. The staff doesn't, it's not really a big deal whenever they return. It's no big deal. We did have someone who was in like on labor and delivery for quite some time, and we had been dealing with substance use. And while she was in the hospital, and I want to say it was 3 weeks, it may have even been a month that she was there, but in that time, when her family came, um, there was all kinds of questioning and wanting to come in and look through things that her family had brought to her. Um, the father of the baby was actively using at that time. Um, so of course, just because everybody's like on high alert because this person is dealing with substance use, they kind of like automatically look at him. and he was removed by security because he got heated and had a confrontation. Um, I went up to see this person several times, and I can tell you, like, I asked if I could take her downstairs to the cafeteria, and it was a whole big ordeal. She had to sign out AMA. Um, she had to have her IV removed. And I even said, like, she's going to be with me. We're not going to be doing nothing. Like, I'm going to take her down the cafeteria and just like get her out of this room because she's been in this room. And I mean, it was a whole big thing. And then I didn't realize, but she told me later that whenever she came back in, they had to do a drug screen on her. So allowing the privileges of some patients and then automatically denying somebody who has a history of substance use. Um, overcharting on behaviors that you don't necessarily know exactly what is causing that behavior. Like somebody being really heated or something, you don't know if that person doesn't have it's a trauma response, or so we have to be careful of how we chart things, calling people names, and of course making comments. And when we say things like at the nurse's station or around the corner from the room, we don't realize that people can hear that, even if it's not the person in the room. Their family walking down the hall, they can hear that. Um, so um, also, accusing those who are in recovery of continued use. That's very common, very common. Um, Not considering that medicated assisted recovery, like methadone or Suboxone, Subutex, not considering those things to be recovery, for them to be actually sober. Um, um, Referring to babies, like I said earlier, referring to babies as addicted or drug babies. Babies are not addicted. Um, there's a lot that goes into everything that goes behind addiction and what happens in your body and in your brain. That doesn't happen to babies. When babies are born, they have been exposed. They can go through withdrawal, but they're not born addicted. I did a presentation last year, I think in Charleston, and it was for a group of peers. And I was talking about the same thing, and I said that babies aren't addicted, and after the presentation, I had three women who worked in recovery. They were peers also, and told me that they were really grateful that I said that. The one lady, I think it had been 7 years, her little boy was 7, and she said the entire time, he's autistic. And she said a doctor told her that her drug use contributed to his autism. And she said that she's been carrying this guilt this whole time. And she's so afraid that when he grows up, he's going to be an addict. And, the other two ladies were expressing basically the same thing, that they were afraid that because they used during pregnancy, that their babies were going to be addicts. So internal judgment, um, huge. So these are some patient statements. One that always hits me is, do they think I want to be like this? Like nobody wants to be like this. It's not, I always say, like, from my personal experience, I can tell you, the first time I used, I was 12. I was somebody who I've been through a lot of trauma at a very early age, and finding alcohol at 12, made me feel different and not think about those things. And I didn't have these fears and everything. Um, and, when I was 14 and I was drinking and doing other drugs and, starting to experiment with what other stuff, it was all fun. And, I thought I was just out partying and everything. When I was in my 30s, it was not a party anymore. It was not something I wanted to do. I did not want to be like this, and whenever I was 12 and 14, that wasn't my intention. You know, um, I say, like, people always say, like, people make the choice well, my first use of 12 was not really a choice of, you know, somebody who's in a good place. I was a child, had been through trauma, so of course I'm not going to make a good decision. Um, saying that the lady saying that she used to talk about other people and never thought that she would be like that person that she had been talking about. Um, and I can tell you, like, this is where I say that it was really, really a wake up call for me to see how stigmatized people who are pregnant truly, truly are. I sit in with one of the Suboxone groups, and we had we were meeting in person at that time, and we had, I think it was like a weekly group or something, and there was two ladies who pretty much had the same gestational period. Both of them had the father of the babies were involved, and they had jobs, and these ladies both had transportation, and they had housing, and everything was pretty much the same in their lives. Well, the one lady came in and admitted that she had a return to use. So of course, everybody in treatment team is telling her, like, we're so grateful that she came back. We're really proud of her. Um, I always say, like, you have a choice. At this point, you have a choice of like if you're going to come back or not, because you haven't been using for a little while. So that one use, you can still kind of pull away and come back to treatment. So that's a huge, huge decision. And by the end, I think that she wasn't beating herself up so much, and so we left and we were walking out. Well, I was with the other lady, who, like I said, was very similar situation. And the lady who had returned to use was walking way ahead of us. And the lady that was with me turned around to me and said, "Can you effing believe her?" And I was kind of taken aback, and oh, kind of looked at her, and she said, "Her using while she's pregnant." I said, "Well, we're addicts. We're here for treatment." Like, and she said, "Yeah, I know, but I stopped using whenever I found out I was pregnant." And so I told her, "Well, I mean, that's great. That's wonderful. But there's some people that don't, it doesn't click until the baby's born, and they see the baby and they get to hold the baby. Some people it doesn't click until the baby's been removed and it's 3 months down the road, and then it clicks, and then I said, and then there's some people that they don't get it until their kid's 19 and getting arrested for their own addiction. And she like kind of looked at me, and I said, "Yeah." I said, I said, you can't judge anybody. I said, "We're all here for recovery. Um, and when we're judging each other, that's all we're doing is like holding somebody else back. So you don't know somebody's story." I was like, "You don't know what was going on in her home. You don't know what's going on in her head. We don't know what caused her to return to use." So, and seeing that judgment from somebody else, uh, it hit in a whole different way. And I can tell you, so on like for my personal recovery, I do 12-step meetings, and years ago, we had a lady who came into our program, and she was like the very beginning of her pregnancy. So, of course, she wasn't showing or anything. I come into a meeting, and this woman's in there. Of course, I'm not going to acknowledge that I know her, and she doesn't acknowledge that she knows me. Um, and, at the end of those meetings, everybody usually circles up and holds hands or hugs and does like some sort of a prayer at the end. And so the the 12-step program I get to usually, like, so if I'm closing a meeting, I always say, "Can we have a moment of silence for the addict that still suffers inside this circle and out there?" And then follow that with the we version of the serenity prayer. Okay. So, and it's everybody, it's not scripted. It's like whatever you choose, you know. So if they say, "Hey, Susie, and take us out of the meeting," like so, that person closes the meeting with however they want to word it. Also, this person closed the meeting, and he said, "Can we have a moment of silence for the addicts that still suffer and the babies that are caught and the disease of addiction with no fault of their own?" And I'd heard that before, and I that was the first time I'd heard it, and it hit like, and I had a lot of empathy for the woman who I knew was pregnant, and she never came back to another recovery meeting, and so since then, it's been years. Pretty much everybody that I know knows that if I hear somebody say that, I'm usually walk up to them and say, "How do you know somebody's not pregnant?" You know, and 12-step meetings are not for babies or children or, wives or husbands. They're for us. And, it's for us to support each other and not exclude somebody. And I had a guy tell me that that was really great that I stepped up and said something. And he said, "But I want to tell you," he said, "my wife and I have had our kids removed, and it's been 6 months now." And he said, "I'm working really hard to get all three of our kids back." And he said, "I come to these meetings for support. And every time I hear that," he said, it's a reminder." He said, I come to the meeting, I feel better. When it's the end of the meeting, I start feeling like, okay, I got another day, I can do this." And he said, and then they close the meeting and somebody says something like this. And he said, it's just like, a gut punch every time. He said, "So thank you for saying something, because it's not just the women who are pregnant. It's also guys, families."
Get a comment in the chat, and it said, according to Shatterproof in their STASI index, stigma is much higher in healthcare than in the general public.
Wow. Wow, that's astounding. That's astounding. Because on my personal view, I guess like I see it because I can see more of a change in healthcare, in the past 8 years that I've been doing this job. I can see like a lot of change in the healthcare system for the good. Um, Actually, this afternoon, I'm going to go talk to a group of nurses and talk to them about the same thing. So I know that hospitals and educators, they are making a difference. So I guess I guess I see that as like I see more of an effort in healthcare to change set things than I do in society. In society, I feel like it's up to us to like let people know. I tell our folks that are in our program all the time, one of the biggest things that's like helping to stop stigma and change people's mind is us. Because for a long time people didn't think that people could recover, you know. Um, and that if somebody has this horrible past and the things they've done, and they continue to judge them, well, if I walk around and nobody knows that I'm in recovery, you don't know that I'm basically saying that recovery is possible because of my life. And same way with all the people who are in our program. All these people, their lives are proof that recovery is possible. So I feel like that kind of changes society, but I don't know, I feel like there's still a long way to go on that. So what we're doing right now, like talking about this, and taking a look at it, and that's one of the ways that we fix this. Building some empathy and compassion and some understanding, doesn't mean you have to agree with it. To be honest, there's a lot of stuff that I encounter with my job that I don't agree with, but I don't have to let that person know anything. I'm there to have empathy and compassion and understanding. Using person first language is huge. Um, And a big one is understanding your own biases. And I can tell you that a few years ago, I thought I don't have any biases. I'm the most open-minded person, and I did the Harvard bias test, and I realized that I do have some biases. Um, that test was very thorough, and I didn't realize it. And now knowing that, um, I kind of like check my body language and check my tone of voice and check my things, whenever I'm encountering that kind of situation. And of course, resources for people who are pregnant and parenting, and who have infants and are dealing with substance use.
We had some more comments in the chat. Christy said, healthcare is the leader of destructive attitudes when it comes to addiction. There's rock bottom levels of empathy, which is amazing because we all have some type of addictive behavior. Even exercising can be overdone and cause issues when not managed properly due to addiction. We don't want to be enablers.
Yeah, I can say there's a line of that though. I mean, having empathy, because I've had people say like shopping or food or other things, and I can say like even in my personal life that I've had to watch a lot of other stuff, not just drugs. I've been clean for all this time, but I had an issue with food, so um, and a lot of people I knew are in recovery. Like it's the same thing. Like a lot of people who are in recovery are dealing with gambling or shopping or food or but at the same time, um, you don't see people go to the lengths that somebody who's using drugs, you don't see them go to the lengths to, get more. Um, you don't see like someone like, if you have a shopping addiction, someone does not have to like get up in the morning and go on the app and shop just so that they're not throwing up and sitting on the commode, you know. Um, so I mean, I can see the similarities, and it's a really good way of empathizing with someone. But it's like, take that and then multiply it by 100, because there's a lot of times where I see people like do things that just you know would astound you, but then at the same time, like you think, you know, I always I like this is to me this is a good example. The best way that I've been able to explain it is like it's like air. Like when people are in active addiction, it's not like a choice. It's you have to do this. And even if it's not withdrawal, physical withdrawal, I can tell you I did drugs for a long time that didn't make me go through physical withdrawal. I couldn't handle the things that were in my head. I couldn't handle the trauma that I've been through, and I couldn't handle depression and anxiety. I couldn't handle all these things that were going on in my head. So in my mind, in order for me to get through another day, I had to be high. I had to not even be high, I just had to be like not in my normal state without substances. That felt normal, more normal to me than not having anything. And so I always tell people, like, so if you imagine breathing, okay, and this is your last breath, you don't have a breath, but I have a whole pocket full of breaths. I got a backpack full of breaths. Are you going to sell your food stamps that feed your kids? Will you sell a little bit of your food stamps to me so that you can have another breath? Yeah. You know, um, are you going to trade your television, so that you can have another breath? This is where we see like prostitution. Okay, if you think about it in terms of breath, like, this is why a lot, stealing, all these things. This is why, because it does feel like uh like you're not going to survive, and it's not like a conscious thing, it's like a subconscious. This is like living. So kind of trying to think of things on that terms. These are so the Harvard, the implicit Harvard, uh, that was the one that I did. And then I've had a couple people tell me about these other ones. If you can screenshot this or take a picture of it, or I suggest that everybody do this if you haven't already. Um, it's very enlightening. Um, like
I
I
can
said,
share them in the recap.
oh, okay, great. Thank you. That would be awesome. I think it's really helpful to even know where your biases are.
There's
So
also some more comments in the chat. Peer support is a wonderful resource for pregnant and parenting folks navigating systems, allowing them a relatable support person who can potentially attend appointments with them and advocate in real time for proper non-judgmental care. And then someone said meth is a demon.
yeah, meth is really bad in our state right now. So yeah. So talking about peer support, that's a good. um, so in West Virginia, we have the perinatal partnership. The perinatal partnership does a lot of things for people who are pregnant and parenting infants. And so one of the things that they do, you want to go to the next one? One of the things that they do is the Drug-Free Moms and Babies program. So the Drug-Free Moms and Babies program supports healthy outcomes of mothers and babies and provides prevention, early intervention, addiction treatment, and recovery support, and a whole slew of other things. We have, I want to say 27 sites now. I think 27 sites now. And a lot of those sites have peers. So, and I always say, like, our peers, our training is like we have to have peer training, of course, but then a lot of us also have lactation training. A lot of us have been trained as doulas. A lot of us have had mental health training, and a whole bunch of other training that really, really helps to support people who are pregnant and postpartum. So the program, it basically encompasses that person, and we try a lot of times to overlap a lot of services. So there might be things that we do, like trying to get people signed up for resources and everything. But we also think it's a good idea to have in-home services. So we like to work with a lot of different programs, because those are the things that help people not slip through the cracks. So, of course, maternity care and substance use treatment, and then social services, and then the drug-free moms and babies. And the drug-free moms and babies, I always joke whenever I first started, I was like, who's thought up this name? Like, this is nobody wants to say, I'm part of the drug-free moms and babies program. Um, so each one of the sites is called something different. Actually, like if you're work with one of the hospitals, you might be working with one of the drug-free moms and babies programs and not know it. Like Clarksburg, their program is called Better Beginnings. Our program is called ACE, for Assist, Connect, and Encourage. So each site has a different name, but we're all drug-free moms and babies programs. And each one of us are a little bit different depending on the hospital that we work with. Like for our hospital, some of the hospitals are the drug-free moms and babies program at that hospital might have an office there at the hospital, because they have one OB office, they have the labor and delivery that's all right there. WV is not set up that way. We have 3 different OB clinics, and only one of them is there in the same building as labor and delivery. So a lot of times, in our office is actually at the health science building, which isn't, we don't have like a private office. So a lot of times I make phone calls from my car. I work from home a lot. I do a lot of stuff out in the community. Yesterday I spent my day doing home visits, and went to met somebody at Sheets actually, and had a cup of coffee, and so our program's a little bit different, that just kind of meet people wherever they are, and also at OB visits. That's one of the things that we do a lot too, and going into labor and delivery whenever the person delivers. So our program is set up that we have a midwife for our primary, and that's Kelly Lemon. Shannon Hoskins is our program coordinator, and then I'm the peer, and also community health worker. So we are grant funded, and we have over 25 sites across West Virginia. Um, and of course, like I said, our program is housed in WVU at the Morgantown campus. So in order to be eligible, someone needs to be receiving Medicaid, be pregnant or postpartum up to 1 year, receiving care. So for us, they have to be receiving care from WVU OBGYN. If they are somebody who is getting their OB care in Clarksburg, then they would have a referral to Better Beginnings instead. And then current or prior use. And, we've had somebody that was signed up and they had been in recovery since 2017. And when I talked to this person, this was their first pregnancy. And we talked about like how, when things happen, like recovery can be like a little bit stressful, like, trying to navigate your recovery and hang on to that, and all the things that you need to do. And I was like, but then also pregnancy and all the visits and all the things, that can be stressful. So, having support for both of those things is a good idea. And so, of course, the woman, wanted to sign up for the program, and they have to be 18 years or older. So, of course, you have peer support. They can enter, like I said, anytime. We have a mom and baby pantry that's located at the health science building. So I pretty much take, it's hard to take someone up to the pantry. A lot of times, honestly, what I do is I go and I take pictures, and I'm like, all right, this is what I have, this is what I have. Or I tell people, write me a list of all the things you need, and then I'm going to see what's in the pantry to get them to you. And then I'll either meet them at their appointment or deliver them to their house. Just depends. And every Wednesday, we have a meeting that's online. It's ACE Moms meeting. And I can tell you, when I first started this job, they were doing once a month, they were meeting in person, and there was only like a couple people that came. And then those people delivered. And then for a couple years, we had one woman that came, and she would come every single Wednesday. And whenever COVID happened, we couldn't meet in person. So there was one of our people in our program, wanted to come in person and stuff. So I started doing it on Zoom, and that person, like, so we started doing it every week instead of doing it once a month. And then, we had more people coming and more people coming and more people, and and I can tell you, I went on vacation a couple weeks ago, and one of I call them the alumni, one of the people who used to be in our program, and she's doing really well. She covered the group for me for 3 weeks. Like, she made sure that meeting was open for the other people, because it's a big thing, because a lot of the people that come into the meeting really appreciate the fact that they can say whatever they want to say. I always tell them it's our meeting. Um, it's, if they want to talk about the kids, they can talk about the kids. If they want to talk about, their partner, they can talk about that, whatever they want to talk about. And it's not like a regular recovery meeting where things are structured and things like that. And our program is basically like a bridge between the gap in OB care and social needs and community resources and substance use care. So these are some of the services, transportation and housing and making sure people have utilities, and referrals to home visitation, domestic violence. Like I said, referring people to a lot of services that cover a lot of things that we cover, but that person might be able to sign them up for something I can't get somebody to sign up for, or they get them on a day that they are willing to do something on where, I'm there on a day they don't want to do that. Also, access to the mom and baby pantry. Um, and then we also have in-person and telephone support um, from myself and our program coordinator. And then, I'm trained in lactation and labor support, postpartum support, and mental health services, and all that kind of stuff too that helps. So if you would like to make a referral to the ACE program, if you are within WVU Medicine, you can make a referral through Epic. Also, you can call or text, and I will say our coordinator is out on maternity leave right now. So the office line goes to her, and her number aren't available at this moment, but they will be. But of course, you can call or text me, and then, or you can email me. I'll tell you, it's always easier to get me by a phone call or a text message, because if I'm out and about, I'm not checking email. And then if you're not in Morgantown area, and you don't have a client who is with WVU Medicine, and they're in another county or something, you can look on the Perinatal Partnerships website, and they have different initiatives on there, and go to the Drug Free Moms and Babies initiative. And at the very bottom, when you scroll to the bottom, it has like all the different counties. And when you click on the county, it'll show all the different sites. Like for Mon County, there's one at Mon General and then one at WVU Medicine, and it has the contact information for both of those. So if you have somebody who's in Mon County and they're going through Mon General for their OB care, you would call that program. If it's somebody who does not have OB services, you can go ahead and contact us, and we can help to get them OB care.
We had another comment in the chat. Oh, and I lost it. Oh, here we go. So it says many of our participants use, like referencing to the meth comment, use it for self-directed medical treatment, and you would never guess because they are functional members of society and don't present with the same stereotypes people have come to use with meth use. All substances are really morally neutral. I found that some of the more problematic behaviors stemming from stimulant use can actually be attributed to the lack of sleep or nutrition. This isn't to say that the substances don't ever create consequences themselves, but they can be better managed with harm reduction approaches that address these issues.
Yeah. Yeah, pretty much each substance. I think like we're going more towards that direction of like looking at what substance this person is doing, and gearing their treatment towards that. But we still have a long way to go with that. Um, yeah, so thank you guys very much, and I appreciate the questions. I think I saw something else come in.